I'd like to ask for your permission to use this video, both of you, for educational purpose and on internet.
Yes.
Tell me about your pain and how long you had it, and tell me about what have been bothering you.
I've had back pain on my right side for probably 5 years. And I got an opinion about it.
But let's talk about your symptoms first. 1 to 10, how bad was the pain? Or is the pain?
The pain can be anywhere from 5 to 10 on a scale, depending on how active I am.
So tell me, what can you do or before the pain make you stop?
I can walk maybe 6 minutes and then I have to stop.
You have a name for that. We call that claudication or spinal claudication. That is a sign that something in your spinal cord pushing on the nerves. How long have you been like you can do only 5 or 6 minute walk? How long has it been?
Probably at least a year.
A year. And you have as well pain in the legs?
Pain in my legs, down the back side of my leg.
Same time frame?
Yes.
Now, now this has been going on, and you said a few years back you met with a surgeon to discuss what's going on.
Yes, I did 3 years ago.
How many years ago?
3 years ago.
3 years ago. So tell me about, without mentioning any names, how did that conversation go?
Not very well. He showed me an x-ray of my spine, said I have scoliosis, and said that at that point there was...
May I just turn around and show your scoliosis first here? This is what you have. You have what we call about 45 degrees scoliosis, meaning in the front view of your spine should go up and down. Yours is not. Yours is making a truly very severe bend, and most of the bend is coming from here, but look at that. Here is so bad that your spine is trying to grow and has grown in this level by itself. You have more problem there, but most of the symptoms, especially you told me your symptoms are mostly in the side and the back of the thigh, is coming from the bottom 3D. So this is a severe finding. This is not a trivial finding, and I can imagine that this finding hasn't gotten better in the last 3 years. So you were told you have a scoliosis.
I was told I have scoliosis, and told me I could use PT and a back brace, but he would not even attempt to do any surgery until I was in so much pain I wanted to commit suicide.
Oh, sorry to hear that. Now, you say the pain can be with certain activity up to 10. How often is the pain 10? A daily base?
Maybe not daily, but it just depends on how active I am. So
yeah.
Once, twice a week.
Yeah. Now, did he explain what kind of surgery could fix this problem to you?
No.
Did he, the x-ray were the only things that you were
just
looking
an
at?
x-ray. Mm-hmm.
Yeah. No, obviously this is a difficult situation, and I think most of us, we surgeons, are trained to weigh risk versus benefit. And sometimes it's true that in our hand, the risk versus benefit is not in your favor to get a surgery done. And this surgery, a big open old-fashioned surgery, can be extremely dangerous. Sometimes it can be, people don't recover from that. And I cannot fault my colleague to tell you that he doesn't really want to do the surgery. I think that was the point. He didn't want to do the surgery because he weighed the risk versus benefit in his hand, which wasn't in your favor. But I think a better way to do that when the things becomes beyond our abilities is send the patient out to somebody else who can deal with the problem, who has, like, as we talked about, if you come with a heart problem to me, I'm going to tell you, no, I cannot fix your heart problem, but I will pick up the phone and find a cardiologist or cardiac surgeon for you. And I think that is a more prudent way for us surgeons. So this is mostly for us surgeons to educate ourselves about that. This on us not to stop at where our ability is. Mm-hmm. How has the last 3 years been for you?
Not good.
Yeah, and I think I'm hoping many of my colleagues take notice of this, that our action, our 5 minutes seeing you in the office and telling you have to live with that, and then we just walk out of here. It doesn't make pain stop for patient. It doesn't really turn your life in a good way. And I can imagine that this problem didn't get better in the last 3 years. And now we have to deal with bigger, most likely bigger problem and 3 years of misery. So, and again, this is as well not only for patient in your situation, that you have the option to look up information online. Internet has been a blessing, but as well for my colleagues, we should look beyond our own abilities. It's okay to have limits. Everybody has it. I have it. But we should always look for other options beyond our own abilities. So I really thank you for sharing this with me. That enables me to train not only patient, but as well as surgeon in my situation. Now, what would you have done differently 3 years ago if you have all the knowledge you have now?
I would have had surgery.
Yeah. What would you tell to a surgeon or a patient that is in a similar situation that you were? What would you want them to know?
That they need to use their resources and their abilities to understand what their inabilities are.
I think that's a very fair statement, okay? Thank you for sharing this with me. I appreciate that. Thank you.
You're welcome.